हेलो। ओ लाला, इसको अब कैसे वहां पे उस पे शिफ्ट स्क्रीन? अच्छा ये देखते हैं फिर इसको कहाँ है।
सर फुल स्क्रीन करके क्लास स्टार्ट कर दें।
अनम्यूट।
सर आवाज नहीं आ रही है आपकी।
हेलो।
जी सर आ गई आवाज, तो स्टार्ट कर दें क्लास सर।
आवाज आ रही है?
जी जी आवाज आ रही है, स्टार्ट कर दें।
तो आपकी आवाज मुझे नहीं आ रही।
बस आपकी सही आ रही है सर, स्टार्ट कर दें।
असल में ये स्क्रीन शेयर नहीं हो रही, मुझे जूम जो है, तो मैं कैसे आगे पीछे करूंगा? अल्लाह के वली, आगे एक ही स्क्रीन थोड़ी लगानी है। आप अजीब बातें कर रहे हैं। इस पे नहीं करते वो, इस पे पेज पे आता है, इस पे आता है और इस पे आप नेक्स्ट नेक्स्ट करते जाते हैं। इस पे थोड़ी है ये तो। इसको भाई हेलो हेलो हेलो।
जी सर।
यार आप मुझे कॉल यार ये जरा जूम की वो विंडो ले आइएगा। नहीं तो इसमें स्क्रीन मेरी जो है वो पीपीटी और वो आपको पीपीटी शेयर तो किया है, आपने तो क्या करना शेयर हो रही है, शेयर तो कैसे मैं नेक्स्ट कैसे करूंगा इसको? हाँ। अस्सलाम वालेकुम। मेरी स्क्रीन शेयर्ड है? बस चले सही। ओके ओके चले। अस्सलाम वालेकुम। ये आप आवाज चेक कर लें। तो उससे कह रहे हैं सही है। आवाज चेक करें। हेलो चले। Bismillahirrahmanirrahim. I'm not able to hear you people, but I hope you all are hearing me. Acha, let's start our session. If you have any questions during the session, you can write on chat box. I have opened my chat box, then I will answer your question. So, Bismillahirrahmanirrahim. So today's topic is being assigned as clinical examination of precordium and relevant general physical examination. My name is Dr. Muhammad Hashim. I am assistant professor of cardiology and interventional cardiologist at Dow Institute of Cardiology, OJA campus. So why did I put this picture on my screen or first slide? That something cannot be, or there are things which cannot be taught or learned online. So as if someone gives you a cycle and guide you how to ride it online, you won't be able to learn it. So this is a clinical, that's why clinical examination is a skill that won't be learned online. For that, you have to have patient and someone who teaches you. So I will try my level best to guide you as much as possible. So same as swimming, you won't learn swimming by taking online classes. So the objective of today's session is orientation with physical examination, correlate your history with your examination, and then how to present to your examiner. CVS examination. CVS examination, before starting any examination, there are some prerequisites for examination. That is, you must be, that is related to you, your patient, and the environment. So the number one thing, what you should have, you should be properly dressed, having your lab coat and all gadgets that you need for your examination. That is your stethoscope, your torch, your pen, your hammer, your inchy tape, everything that you may need for your examination. Number one. Number two, the environment should be that calming or appropriate that you and your patient should be comfortable with the environment. Number three, there should be proper lighting, and the temperature should be adequately monitored. So before that prerequisites, the first thing is that approach to the patient. You should approach the patient from right side of the bed, then introduce yourself like, my name is XYZ. I am going to examine you. What is your name? Then ask his name, greet him, and then after brief introduction and having built up, after building up brief rapport with the patient, then what you need to do is introduce yourself, and then having informed consent that what are you going to do with the patient, what system are you examine, what exactly is expected from him. Because in examination or in clinical examination, there are various steps in which you need patient assistance. So if you don't brief him, so you won't be able to do your proper examination. And the movement that is can be done actively by the patient, you are not allowed to do passive movement on patient. So approach from the right side, introduce yourself, greet him, know his name, and then having informed consent that my name is Dr. Mohammad Hashim, and what is your name? And I am cardiologist and OJA. I am going to examine your chest. Am I allowed? If he says yes, then you will. Then after that, you will ask him, is there any pain? क्या आपको सीने में कहीं पे भी दर्द है, कहीं पे परेशानी है? If he says yes, or I have discomfort, so you have to make him sure that I won't touch that area, or you will touch that area in the land. And meanwhile, if you have any discomfort during my examination, you can ask me, I will stop you there. I will stop my examination right there. So if he give consent, then what you need is you need proper positioning of the patient. For different examination, for different systemic examination, you need a specific position. And for cardiovascular examination, the patient should lie at 45-degree angle. So after that, what you need to do is exposure. Exposure for cardiovascular examination, anyone can write on chat box, what should be the exposure? I'm waiting. क्या होना चाहिए एक्सपोजर पेशेंट का जब आप कार्डियोवास्कुलर एग्जामिनेशन करने जा रहे हैं किसी का भी, तो कहां से कहां तक एक्सपोज करेंगे पेशेंट को? Nobody is writing on chat box. Am I clearly audible to all of you? Kindly write on chat box. Okay. Okay. Chest area, very nice. Thorax should be completely exposed. Neck to the sixth cause, very nice. Chest. Okay. Look, by having the clinical examination is interactive session. You won't learn it. Whatever, this is, you people are third-year student and this is the first interaction of you on clinical side. So make it clear from the very beginning that these becomes your, these becomes your knee reflex or spinal reflex. So you won't be, you will have very क्या कहते हैं इसे कि आप लोगों को फिर ये आप लोगों के जहन में बैठ जाएगा and you will practice rest of life with this. So the recommended exposure to the patient for cardiovascular examination is from the earlobe यहाँ से लेके up till mid thigh. Up till mid thigh should be exposed. But before starting the examination, you will ask your examiner that I want to expose the patient properly for cardiovascular examination. That the exposure should be from earlobe up till mid thigh. But he will, due to certain reasons, he won't allow you that. He will ask you to examine up till pelvis. So perineum should not be exposed, or in certain circumstances you are and you need to expose that area. If if in that circumstances you need to expose that area in the last and examine that area, and then after exposure you will cover it back. So exposure is from the neck or from the earlobe up till mid thigh. But लेकिन हम करते नहीं हैं. हम कहाँ तक, हम पेल्विस तक या बिलो अम्बलाइकस तक एक्सपोज करते हैं. सही. अच्छा. So this is the position for precordial examination or CVS examination. Angle should be 45 degree, or all chest should be exposed up till umbilicus or below umbilicus. सही. और the arms should be abducted. The arm जो है, इसमें जो है arm दिखाए गए हैं वो थोड़े से अंदर है, तो you won't be able to, अगर arms if arm is adducted, so you won't be able to examine the lateral chest wall. So arm should be a bit abducted so you can see clearly the axilla and the lateral chest wall. So before starting systemic examination, you have to have general outlook of the patient. Is the patient stable or not? That is hemodynamically or clinically. You see a patient is sick looking or he is comfortable, or then what are the lines attached to the patient? Lines कौन सी होती हैं बताइए जरा. कौन सी lines you will look for lines to the patient whom you are going to examine? Just write on your chat box because I'm not able to hear you people. प्लीज लिखें, लिख सकते हैं आप लोग. अच्छा. मिड क्लेविकल. No. Lines means कि आप क्या IV लाइन है, और जो है IV लाइन है, या कोई एंडोट्रेकियल ट्यूब लगा हुआ है उसको, या CVP लाइन है, या फॉलीज कैथेटर है, या NG ट्यूब है. बिल्कुल. This will brief you, this will tell you how sick the patient is. सही. तो ये सारी लाइंस आपने देखनी है कि पेशेंट को डबल IV लाइन है, सिंगल IV लाइन है, बिकॉज दिस विल टेल यू कि आपने कहाँ टच करना है, कहाँ टच नहीं करना. सही. तो इस वजह से, और देन आपने देखना है जनरल बिल्ट ऑफ द पेशेंट. क्या पेशेंट जो है वो ओबीज है या थिन लीन बिल्ट है. सही है. डॉर्फ है या जाइंट है. सही है. टॉल है. ये आपको दिस विल गाइड यू कि पेशेंट को कौन सी बीमारी हो सकती है. देन वाइटल्स. वाइटल इज वेरी इंपॉर्टेंट बिफोर एग्जामिनिंग, बिफोर हैविंग जनरल फिजिकल एग्जामिनेशन और सिस्टमिक एग्जामिनेशन. सबसे पहले आपने वाइटल्स करना है एक पेशेंट का. while having clinical examination you must have everything with you that for the patient, that is आपकी sympathy होनी चाहिए, empathy होनी चाहिए, and you have that feeling for the patient that you are not dealing with machine. सही है, आप कोई मैकेनिक नहीं है, आप कोई इंजीनियर नहीं है, you are dealing with the human being. So उसका रिस्पेक्ट, उसको रिस्पेक्ट, the respect is first. आप you have to give him respect. So आपने vitals देखने हैं. Vitals में if he is or she is vitally unstable, then अगर वो vitally unstable है तो फिर क्या करना है? फिर you won't continue your examination. You will ask your examiner that the patient is having this problem, he needs immediate treatment, so I'm not able to examine this patient. हुआ ये कि हमारा जो the supreme examination or the superlative degree of Pakistan in medical science, that is FCPS. FCPS में हुआ ये कि एक पेशेंट को आया था वो शॉर्ट केस में कि उसका जनरल फिजिकल एग्जामिनेशन करना था. Then the candidate is being asked to have examine the patient. The moment he went to the patient, he saw the patient, that patient is shivering. पेशेंट इज शिवरिंग. तो उसके बाद थर्मामीटर था, फौरन से उसने उसका टेम्परेचर देखा. टेम्परेचर देखा तो टेम्परेचर जो था उसका 103 डिग्री फ़ारेनहाइट थी. और ये बहुत ही मुश्किल एग्जाम है और इट वाज 103 डिग्री फ़ारेनहाइट. तो क्या हुआ वहां पे, उसने फौरन से अपने पॉकेट से 2 पेनाडोल निकाला, पानी की बोतल उसके पास था, उसको 2 पेनाडोल खिलाए और पानी पिला दिया और कहा प्लीज आप रेस्ट करें और कुछ करने की जरूरत नहीं है, हम आपको अभी शिफ्ट करते हैं. And he went to the, and the examiner was observing all these things. He went to the examiner that I won't be able to examine this patient, as patient is having 103 degree Fahrenheit temperature and he is not stable, he needs to shift to the hospital. देखें the that thing, जो this empathy and sympathy of the candidate जो है is being useful for him as well as for your patient. क्या हुआ, उसको फौरन से पास कर दिया और he examiner said you don't need to have you passed your exam, don't need to worry, you don't need to examine the patient. Acha. Then after vitals you can proceed. If you find him vitally stable, then you need to go through your general physical examination and then systemic examination. What this picture describe, ये बता सकते हैं कोई? Just for the change, आप लोगों को थोड़ा सा हंसा भी दूं, थोड़ा सा माइंड फ्रेश करूं. That was that because he was not giving IV, because usually these exams take place in college, that is College of Physician and Surgeon, Pakistan. So that is not hospital. So in that hospital usually the IV medicine is not there, availability नहीं था. लेकिन पैरासीटामोल जो था वो पेशेंट के पॉकेट में या उसके जो गैजेट्स में साथ था, that's why he given him paracetamol. So ये क्या है बता सकते हैं? Poor construction plan, online graduate, जबरदस्त, that is the correct answer. So be very careful, right? आप लोग भी online अब clinical examination जो है वो online दे रहे हैं, तो अगर ऐसे डॉक्टर ना बन जाए कहीं, सही. तो ये भी इस बंदे ने भी जो है वो online classes ली थी for engineering. So vitals, in vitals you have your pulse, your blood pressure, then temperature and respiratory rate. Pulse में जो है you have to see all pulses of your body and then correlate आप दोनों पल्सों को, रेडियो रेडियल डिले, रेडियो femoral delay, then you need pulse rate क्या है, and then volume क्या है, regular है, irregular है. You see many things. Pulse examination is a separate entity. When you come to the pulse, then inshallah in next classes we will teach you how to examine the pulse and all. Then blood pressure will tell you either the patient is hemodynamically stable or not, hypotension, hypertension, normotension. So yeah, what is the mean arterial pressure, then what are the pulse pressure, so temperature, and then respiratory rate. Like every systemic examination, what I like to do is examination, clinical examination, every single person have its own way of doing it. Neither किसी भी तरह करें वो गलत नहीं है, that lead to your diagnosis, आप वो properly आपको diagnosis की तरफ lead करें. What my method is to do, having vital examination, after vital have general physical examination, and that general physical examination would help you कि मुझे systemic examination में कौन से system पे ज़्यादा emphasize करना है. I usually do that, but we will stick with the topic that is being assigned to us, that precordial examination, and then after having precordial examination, then we will go to general physical examination with relevant to cardiovascular. सही है, तो यूं भी करें ये भी सही है, if you go that way वो भी सही है. You have to have your own method that lead to your diagnosis. So precordial examination, precordial, like every systemic examination, that is abdomen examination, chest examination, CVS examination, respiratory examination, every single examination have these 4 sub parts. That is inspection. In inspection, you will only observe and see your positive findings. Then you palpation, you will palpate it. Sorry, palpation has 2 parts, that is superficial and deep palpation. Then you will have percussion and auscultation. So in cardiovascular examination, fortunately, we don't have percussion. So you just need to have your inspection, palpation, and auscultation. So we won't do it percussion in cardiovascular. So in inspection, what you will see, inspection, how we will inspect the patient. Patient will be on 45-degree angle. First, we will go to foot side of the patient, foot end of the patient, and then comes to at eye level. जो eye level है, उसके body का, उसके chest का, उसी level पे आना है. And we will observe shape of the chest कैसी है, symmetry कैसा है. What should be the normally shape of the chest कैसा होता है? What is the normal shape of the chest? Please write it in chat box if you have any idea. There are different shape of the chest. So yeah, truncated cone, okay. Shape of the chest जो है वो elliptical हो सकता है, then ये truncated cone भी हो सकता है, exactly, and then you will have barrel shaped chest, if you heard about that. तो barrel shaped chest हो सकता है, सही है. Normal shape of the chest is elliptical. That is, the lateral diameter of the chest should be more than two-thirds, more than half of the double of the anterior posterior diameter. The anterior posterior diameter is less than half of the lateral diameter. सही है. तो laterally chest बड़ा होता है, anterior posteriorly कम होता है. और when it becomes the anterior posterior diameter is equal to the lateral diameter of the chest, that is called barrel shaped chest. And the barrel shaped chest is usually patient have or COPD or bronchial asthma, इन लोगों में जो है वो barrel shaped chest होता है. Exactly. अच्छा. Then shape of the chest, we will say कि कोई deformity, congenital deformity तो नहीं है, kyphosis, scoliosis, pigeon chest जो है वो नहीं है, pectus excavatum, pectus decavatum, ये सारी चीजें तो नहीं है. Yes, pectus जो है वो carnatum, pectus excavatum, ये सारी deformity आपने देखनी है. And the the other thing you will see के nipples जो है is in its position, सही है, कोई axillary nipples तो नहीं है, then you will see कोई scar mark तो नहीं है patient को, सही है, previous कोई cardiac surgery तो patient की नहीं हुई, central sternotomy तो नहीं है, then कोई minimal surgery तो नहीं है, apex में तो कोई scar नहीं है. So you will see all this, and then you will have observed both the lateral side of the chest, left side as well as the right side, and then pigmentation, कोई extra pigmentation तो नहीं है, and then you will see कि in male patient के gynecomastia तो नहीं है, because there are medicines, cardiovascular medicines or drugs that causes gynecomastia. Okay, gynecomastia तो नहीं है patient को, and type of respiration क्या है. These all things you need to observe in inspection. After inspection, what you need to do, have general palpation. In palpation, you need to do is general palpation, apex beat, right ventricular heave and rub. How to do it? तो बिल्कुल उसी तरह है कि मैं अभी यहाँ से कहूँ कि आप स्विमिंग पूल में जाएं, वहाँ पे डाइव मारें, सीधा हाथ आगे करें, उल्टा हाथ पीछे करें, सर नीचे करें, पाँव ऊपर करें. So this is how I can help you out, but I will try my level best to help you all areas of the chest. In general palpation जो है वो अपने सारे chest को बिल्कुल जिस तरह इन्होंने हाथ रखा हुआ है, that your fingers should be adducted and you palpate all 4 areas of the chest. इसमें आप rub देखेंगे, इसमें आप जो है कोई टेंडरनेस देखेंगे, सही है, इसमें आप टेम्परेचर भी देखेंगे चेस्ट का, और इसमें एरियाज, डिफरेंट एरियाज ऑफ द हार्ट को पल्पेट करेंगे कि कोई ब्रूई तो नहीं है, कोई पल्पेबल हार्ट साउंड तो नहीं है. Then what you need to do is you need to abduct your fingers. You need to abduct your fingers, and your fingers should be intercostal space. सही है, intercostal space पे आपके fingers हो, and you need to have apex beat. अगर apex beat आपको जो है फ्लैटली जो है आपको apex beat पल्पेट ना हो रहा हो, what you need to do is patient को slightly left जो है वो tilt करेंगे. By having slightly tilt of the by having slightly tilt to the patient, you will be able to palpate the apex beat. Then after having apex beat, you need to calculate and you need to mark where you find the apex beat. Usually the apex beat is palpated at 5th intercostal space at mid clavicular line. After having apex beat, then you need to have right ventricular heave. How you need to do right ventricular heave? The right ventricular heave is being done by putting your hand on left side of the chest, slightly lateral to the sternum, and keeping your finger upward. सिर्फ अपने सोल ऑफ योर हैंड शुड बी, पाम जो है वो आपको जो है वो टच करे बॉडी को, लेफ्ट टू द स्टर्नम, और यहाँ पे इफ देयर इज लेफ्ट वेंट्रिकुलर राइट वेंट्रिकुलर हीव, तो आपकी जो है वो हाथ जो है वो उठेगा. दिस विल टेल यू कि राइट वेंट्रिकुलर हीव है या नहीं है. देन आफ्टर दैट you will look all over the chest for pericardial rub. So this is the cardiac cycle. You can see that different pressure curve. This is very complex. आप इससे घबराएं मत, आपने फर्स्ट ईयर में तो ये किया होगा. We have 2 phases of cardiac cycle, that is systole and diastole. अच्छा, सिस्टली, स्टार्टिंग ऑफ सिस्टली में जो साउंड आता है वो S1 है, एंड स्टार्टिंग ऑफ डायस्टली में जो साउंड आता है वो S2 आता है. And so these sounds are produced normally. The sounds are produced by closure of valve. सही है. The first start sound is produced by closure of mitral and tricuspid valve. सही है. And the second arch sound is produced by closure of aortic and pulmonary valve. सही. तो ये due to these pressure changes which is being seen in red line and black dotted line, तो ये प्रेशर चेंजेस हैं जिसके ज़रिए जो है वो valve opens and closes. So normally we have two sound, S1, S2, S1 due to mitral, and it is being heard due to closure of mitral and tricuspid valve, and S2 is being heard with closure of tricuspid, sorry, semilunar valve, that is aortic or pulmonary valve. So yeah, S3 and S4 are added sound, or we will discuss it later. Or जो sound, the sound that is being heard in systole, systole के duration में in between S2, S1 and S2 is systolic murmur. The sound that is being heard between S2 and S1 is diastolic murmur. सही? अच्छा, which areas need to auscultate? You have to auscultate all 4 areas of the chest, and you need to know कौन-कौन से areas हैं और कौन से areas किस sounds के लिए हैं. सही? तो ये 4 areas, you need to auscultate these 4 areas, that is mitral area, tricuspid area, pulmonary area and aortic area. सही है? तो ये different areas हैं, ये आपने auscultate करना है. And different murmurs, अगर इनमें आपको added sound या murmur मिलते हैं तो ये murmurs जो है वो different phase of cardiac cycle में बढ़ जाते हैं और it will get exaggerate in different maneuvers. सही है? when we will examine the murmur, or we will have patient with added sound, then I will let you know, or if you people have chance to have classes with me, and we will examine the patient in ward and let you know. So these, at least you should know the areas which is being auscultated for different heart sound. Right? Then after having your this is all after you are not done right here. After that, what you need to auscultate is you need to auscultate bases of lung as well, to see if there are any craps or not. Because craps are usually due to heart failure. So you are examining cardiovascular examination. So it is not done until you auscultate lungs as well. Right? So you are done here with your cardiovascular examination. If you have any questions, kindly write it right now, or we will continue for general physical examination. S4 is added sounds. When we'll go, but right now we are doing general physical examination and cardiovascular examination. When we will go for added sound, there are other sound as well. As for S3, S3 is due to filling. S3 is due to fast filling of the heart, and S4 is due to atrial kick. In atrial kick, while LV gets filled, so this sound is being produced. Like at this level, at third year level, you don't need to go over this. Abhi, right now, you just focus on first heart sounds, second heart sounds, when it gets auscultated, and the other thing is what is systolic murmur and what is diastolic murmur. So, yeah, while examining the murmur, then I will let you know in detail the S3 and S4. No, we have to see in heart failure, because there are, if patient have general anasarca, so general anasarca and pericordial peritoneal dilatation, or peritoneal swelling, or scrotal swelling, or due to increase intrathoracic or intra-abdominal pressure, if there are hernia. So how will you examine that? How will you examine that? Ye bata dein. Why we expose the mid-thigh? Because there are certain circumstances in which there scrotal or peritoneal swelling has been hote hain, are the peripheral manifestations of the heart failure. So you won't be able to do it until you know it. Sahi hai? तो ये वही बात है, your eyes cannot see what your mind doesn't know. You should have all knowledge that cardiovascular examination, what are the findings in cardiovascular examinations, right? So I hope your question is being answered, sir. If the patient is JVP, if the no, in JVP examination also you need to have this at 45-degree angle. सही है, 45-degree angle में JVP आपने examine करना है, सही. अच्छा, now general physical examination. In general physical examination you must have a overlook, general overlook at the patient, that patient को जो है वो tall है, short है, सही है, और दूसरा स्ट्रेचर कैसा है, कोई congenital anomaly तो नहीं है, सही है. तो why it is important to have all these, because these all congenital anomaly, gigantism, tall, dwarf, these all congenital anomaly has link with congenital heart disease. So these all congenital anomaly will guide you कि कौन सी anomaly patient को हो सकती है, सही. If you have an idea, so your examination and your clinical diagnosis will get more accurate, सही. अच्छा, now comes to hand. अब general physical examination, how you do it? You do it कि आपने हाथ से शुरू करना है, then you go to head, and then from head till toe. So you won't miss it. अगर आप इधर उधर jump करेंगे, then you will miss many things. So more, I have put more pictorial slides ताकि आपको learning में और उसमें understanding में आसानी हो. What you are looking at hand as far as your cardiovascular examination is concerned. तो हाथ में आपने देखना है color के, patient anemic तो नहीं है, then sweating है बहुत ज़्यादा, sweating, how it leads, ये क्या बताता है, sweating tells you that hyperthyroidism or hyperthyroidism can lead to that cardiovascular anomaly or cardiovascular disease. That tar staining or xanthomas, then finger clipping, anemia, splinter hemorrhage, Genival lesions, oscular nodes, capillary filling time, Palmer erythema, and Dupuytren's contracture. These all are the peripheral manifestations of cardiovascular disease. So कैसे देखते हैं, कौन से कहाँ देखता है? Genival lesions you have to see in the palm, and then spider, और इसके बाद जो है वो oscular nodes you need to see on the pulp of the hand, or splinter hemorrhages you need to see on nails. Achha, these are the Genival lesions, and that is the oscular nodes, which is painful, and Genival lesion is painless. Achha, इसमें तो multiple things have been described, that where you see splinter hemorrhages. सही है, ये splinter hemorrhages कब दिखते हैं? ये splinter hemorrhages होते हैं infective endocarditis में. Rod spots, you see rod spots जो है वो infective endocarditis on fundoscopy, and then there are Genival lesions and oscular nodes. This is Palmer erythema. What is Palmer erythema? Palmer erythema जो है ये आपको periphery of the hand, periphery of the thenar, hypothenar, or that near the कौन सा joint है ये, यहाँ पे joint में आपको अगर redness मिले और central area जो है वो pellar हो, central Genival lesions is the yes, metacarpopharyngeal joint, near metacarpopharyngeal joint, then hypothenar or epithenar, ये thenar, hypothenar, or near metacarpopharyngeal joint. यहाँ पे आपको redness मिले और central of the hand में जो है आपको जो है वो pale मिले, तो this is called Palmer erythema. और जो है Genival lesions is peripheral manifestations of infective endocarditis. This is tar staining. This tells you okay, how much is in risk patient for cardiovascular disease. If someone has high smoking habit, so he is at risk of for cardiovascular disease. Acha. After, there are many other things which I skipped, that is cyanosis, clubbing. So yes, cyanosis, clubbing और भी बहुत सारी चीजें हैं that is present in congenital heart disease. Right? After have done with your hand then you need to examine your arm. The arm, what you can get is subcutaneous nodules that is due to hyperlipidemia, and hyperlipidemia or subcutaneous fat nodules get deposit under your skin. Right? And you need to have overlook that area. उसके बाद then after having done with your hand, then you need to go on head. Head में क्या मिल सकता है? Head में आपको सबसे पहले देखना चाहिए हेयर का टेक्सचर क्या है, कोई बॉल्डनेस है या बहुत जो है वो ड्राई हेयर्स है, दैट कैन लीड टू योर a clue that patient may have thyroidal abnormalities which can lead to cardiovascular disease. सही है. और फिर उसके बाद then on forehead you need to have looked over eyebrows. अगर in patient with hypothyroidism have scary lateral eyebrows or eyebrows उनके बहुत ही scanty होते हैं. सही है. Then you need to have see jaundice, anemia, cyanosis, rod spot, xanthelasma, mitral facies and high arch palate. This is xanthelasma. Xanthelasma जो है वो क्या है? This can tell you that patient have familiar hyperlipidemia and he is at high risk for cardiovascular disease. And you can see jaundice, and in lower conjunctiva you can see anemia as well. So yeah, eye examination में. Then rod spot, this you can see with the help of your fundoscope. That is mitral flush or cyanotic. You can see cyanosis at nose, earlobes, lips, and then you can see dental hygiene for different reasons. One of the most common reason is infective endocarditis. Okay, the bugs that causes infective endocarditis is Staph aureus, most common, और वो यहीं से होता है. And this high arch palate tells you congenital anomaly as well, leads to cardiovascular abnormality. अच्छा, ये क्या है? Anyone can guess what is this picture? Any guess? सिर्फ आपके मोड को चेंज करने के लिए I have put these. This is an X-ray of a patient with multiple fractures. सही है. I don't know, मैंने ऐसे ही नेट से लिया है. इसको हर joint के almost there is a fracture of every joint. Arm में, then hand में, femur, टिबिया, सारे जॉइंट्स के उसको फ्रैक्चर है. ये पता है क्या है? ये बेचारे का इसमें एक्सीडेंट हुआ है. ही गॉट एक्सीडेंट. सही है. और क्यों एक्सीडेंट हुआ इसका? इसने भी ऑनलाइन जो है वो सेशन लिया था फॉर ड्राइविंग. सही है. सो बी केयरफुल. सही है. और नहीं इसने ऑनलाइन क्लास लिया. दैट इज नॉट सुसाइडल. और ये जो वो है मीडिया पर्सन है, उसको भी बिल्कुल एथिक्स का पता नहीं है, और उसने भी ऑनलाइन क्लासेस ली हैं फॉर मास कम्युनिकेशन. सही है. बिल्कुल, दीज बोथ आर हैव टेकन ऑनलाइन क्लासेस. तो ऐसे डॉक्टर मत बन जाना भाई. अच्छा, नेक एग्जामिनेशन में जो है वो यू हैव JVP. वी हैव डन विद द हैंड and then head. Now after head you will have your neck. Neck may you need to examine JVP. JVP need to be examined with at 45-degree angle. Then you need to examine thyroid, and then JVP examination is a separate thing that you need to do is with 2-scale method. सही है. और after we will do it clinically on patient when you people come to ward. This is a thyromegaly. सही है. और that may lead to yes goiter. that may lead to cardiovascular problem or disease as well. Acha. This is another patient with thyroid. Or then in thyroid, what we do is we do raise both hands above his head. Then क्या होता है कि the venous return gets occluded. If it gets occluded, means that the thyroid is enlarged or the test is positive and he is at risk. After having neck examination, what you need to do is you come to foot and you need to examine all those things which you examine in hand. You need to examine those on your foot as well. That is cyanosis, clubbing, genuine lesions, oscular nodes. सारी चीजें वो जो आपने हाथ में देखी हैं वो सारी चीजें पाँव में visible हो सकती हैं. और what else you need to do is you can see edema. सही है. और then here this is the patient having severe edema, pitting edema. सही है. अब कहाँ देखते हैं? Usually this is not the ideal place to see the edema. The edema is usually recommended is yes pitting edema. The edema is recommended to see on the shin, the medial aspect of lower foot. जिसमें आप you will yes pedal edema. What you need to do is you compress against the shin bone, so your tibia bone. तो वहाँ पे आपको मिलेगा. Then you after having edema, what you need to do is you need to see the extent of edema, how much it is. Good edema, you need to press it up to knee joint. क्या knee joint तक है, अब foot तक ही है या knee joint तक है या उससे भी ऊपर है. That will tell you the severity of the disease. अच्छा, ये different nodules हैं, xanthomas हैं जो कि present है lower limb में. These are the nodule as well, which is present subcutaneous nodule in lower limb. Whatever you have seen in upper limb, you can see it on lower limb as well. अच्छा, ये क्या है? What is it? Yes, result of online sessions. So here, the moment I get receive mail from department that I need to go over with you people, precordial examination and general physical examination. I was amazed ke how can one teach the skill online? But जो मैंने बनाया, I was in difficulty. लेकिन क्या करें? We must have some. हमें कुछ बनाना चाहिए इसमें कि how to cope up this problem, because this COVID will remains there. I don't know till when, nobody knows. So agar we have if we stick to SOPs or with short stint of a student who come to the ward and examine the patient, that would be helpful, because online won't help you in clinical examination. ये क्या है? This is the beautiful one of the beautiful pool of the world. अच्छा, वो लड़की को जो है just आप उनको क्या कहते हैं ignore करें. What she has taken online session as well, or she doesn't know how to swim. तो इतने खूबसूरत और इतने जबरदस्त pool में she is not able to swim. Thank you very much. If you have any questions, do let me know. I will try to brief you. This is my email address, which I have mentioned. If you have any questions, you can mail me. You can find me in Dow Institute of Cardiology anytime. You can come there or meet me as well. Bedsides, सारी किताबें अच्छी हैं. Those the book that is easy for you or that you have आपको understanding में problem नहीं हो रही है, you should follow that. McLeod is a good book. McLeod जो है, one recommended book is for clinical examination. Other book that people used to have it is Nasir-e-Shabir. वो भी एक systemic book है. You can follow that book as well. Any question? I hope कि आप लोगों को थोड़ा बहुत तो समझ में आ गया होगा, थोड़ी orientation हुई होगी for your this general physical examination and cardiovascular examination. Inshallah, I will try my level best. You ask your department to arrange more session with me, or I am all available for you people. Whenever you people can come to ward or where we can study as well. Chale. Thank you. I will refer to Professor. Sorry. You will refer to Professor Nawaz Lashari for this. What? For what? Yes, you can ask Professor Nawaz Lashari. You can ask Dr. Tariq Farman, that is chairman of cardiology. Both of them are decision maker who can have more session of me with you people. If you have any question regarding this topic, you still have 2 to 3 minutes. If you need this PPT,